Hello and welcome to Health Matters on Channels Television. Thank you for joining us. I am Mary Alale Yusuf. Rational use of medicines requires that patients receive medications appropriate to their clinical needs in doses that meet their individual requirements for an adequate period of time and at the lowest cost to them and their community. That's what the World Health Organization says, adding that irrational use of medicines is a major problem worldwide. It is estimated that more than half of all medicines are prescribed, dispensed, or sold inappropriately, and that half of all patients fail to take them correctly. The overuse, underuse, or misuse of medicines results in wastage of scarce resources and widespread health hazards. Irrational use could be too many medicines to one patient and inappropriate use of antimicrobials, among other things. According to the Access to Medicine Foundation, far too often children are at the back of the queue when it comes to receiving treatment due to the lack of availability of appropriate medicines. My guest is a pharmacist and CEO of One Health, Adeola Ali. You're welcome to the show.
Thank you so much for having me. I appreciate it.
Let's first talk about, those things that the World Health Organization says are essential, necessary to get the right medication in the right amount, for the right amount of time, to the right person and all that. What do you think is the situation now in Nigeria?
Well, not extremely encouraging. I would say right now about 23% of essential medicine, only 23% of essential medicine are readily available. And a lot of people are really having to strategize on how to get it properly, consistently. And when you talk about where they get the medications from, so the pharmacy, right? We only have just like one pharmacy to 50,000 people. And it should be like 1 to 10,000, 1 to 1,000. So it's a problem. So what you're finding now is that you're starting to see a couple of patent medicines vendors. Some of them are more organized than the others. Most aren't. So you're having to find counterfeits in places. People are looking for cheaper alternatives, and they're being the scapegoats for it. So it's caused, like, there's a ripple effect. So there's an access issue. And obviously, there's a treatment issue because now you're taking medication to treat something that is not going to touch it because you're not taking the right medication. It's either counterfeited or substandard. So it's a major problem. And at the going rate, if it continues to stay that way, by 2026, you have about 50% of the population, especially suffering from chronic conditions, not survive.
So you said essential medicines. What are those?
So those are the medicines that you need for typically chronic conditions, so hypertension, diabetes, sometimes even like malaria. And when you're talking about essential medicine readily available, don't think of Lagos, because we're in Lagos. We're thinking, of course, I have my pharmacy. I have 10 pharmacies here, one pharmacy here. No, think of your entire country readily available, meaning I go there, I don't have to come back. I don't have to try to look for another pharmacy or wait for you to change it for me. That
or come back next week.
Do you understand? That is the situation, yeah.
So they're not readily available. That's a problem. Then people get them and they're not using them well.
They're not using them well. Or when they get them, think about it, when they get the drugs, who are you getting it from? So if you get it from a really good pharmacy, accredited pharmacy, following the right protocols, right storage conditions, right temperature regulations, that's fine. But most are not. So imagine I need to, get an eye drop, or it needs to be stored in the fridge, and you have to go through that cold chain. Would it be optimized by the time I get it? So there's like readily available. Is it substandard? Is it counterfeit? Right? And then when you use it, are you supposed to use it 2 times a day? 3 times a day? Are you using it in entirety, especially with antimicrobials, or do you stop? So there are multiple factors, contributing to really treatment, monitoring, and management.
Okay, tell us about inappropriate use of antimicrobials. What is that?
So pretty much inappropriate use of antimicrobials is saying that you're taking the right drugs at the right time for the right period. So when they give you a medication, when you get proper prescription, do you get proper prescription for it? So something is going on. So you cough, right? And do you go straight to go to your pharmacy and get Augmentin to treat it? Did you get laboratory tests? So did you get tested for the right condition, or did you self-diagnose? And then when you're given the drugs, did you take it for the entire period, or did you stop halfway? So inappropriate use is when you do not follow the right prescriptions, the right recommendation for intervention, meaning go speaking to a doctor to get the prescription, and following the right dosage or regimen to completion before stopping. So what we're finding now is a lot of people don't. A lot of people self-diagnose. They go to Google. Google is their friend, or their auntie, or even their house help self. Sometimes, like, I have anything, and your house help says, madam, that drug that I took, that's metronidazole. Just pop it. They have cramps.
Oh. After this, we're going to talk about that.
Yeah.
But continue. There's something I need to ask about that drug.
So, they have cramps, and then their nannies are the ones giving them. I've had situations whereby it's like, oh, yeah, my house was like, wow. So I'm recommending something, and somebody else who doesn't know anything about drugs, I've told you what to do. And that's what it is. They go to the pharmacy. There's minimal interruption for the most part, except you go to a really accredited good pharmacies out there. And I'm sure everyone knows them. They just hand it to you. So you take it. You keep taking it. You keep taking it. Now, when you really need it, and you need it to work, there was a case I was reading the other day that someone had an open heart surgery and got infection on the bed. And now they had to treat them with like another drug for a long time, but the drug side effects made him deaf.
Okay.
Because they had to use a super dose. So now the simple medication that could have...
he had used something simple at the wrong time?
At the wrong time, several times, could not treat it for this open heart surgery. So this is the complications that we are seeing with misuse of drugs. It's a big problem, for sure.
Got deaf.
Yeah.
How about if you use the proper drug for a longer period of time? Shouldn't that get it?
Well, so when you say proper drug, so you have to think about what are they treating it for. So if in this case, here we're saying antimicrobials, like, an infection, right? If you use it for the proper period of time, then that's what it is. Obviously, there's some side effects, and typically, they're usually mild because most infections, you take them for 5 days, 7 days, at most 14 days, at most, but typically 3, 5, 7, and then you're done. But you'll be surprised that after day 1,
they feel better and they drop it.
They hide it. And now when you talk about children, because a lot of kids, apparently about 60 to 70% of the medications, antimicrobials given to children are over-the-counter, not prescribed. So these kids, these 7-year-olds...
should it be over-the-counter?
It shouldn't be. It shouldn't be. That's what I'm just saying. But they get access to it. Like, I'm sorry, I'm a pharmacist. I know what's happening. It's not as controlled as you think. Right? Because the reason, you need a prescription for it, yes. Only very few are still doing that. So now you give this child, from birth, they're already taking antimicrobials halfway. And they pop it and they leave it in their sofa. And it's when you're moving out that you see the medications that they haven't taken. And then over the years, now they have serious conditions, it can be treated. So it's a thing, for sure.
Okay, so back to that metronidazole you were talking about. People, at least people I know, generally understand that when you get an antimicrobial, an antibiotic, you should use it for a certain number of days and you should use it properly. Even though typically people say, well, they said 4 times a day, but who's going to wake up at 2 a.m. and be taking a drug? I'll just do it 3 times a day, but I'll be very religious about it. But then when it comes to metronidazole, they say, no, that's not an antibiotic. I don't need to. I just take it till I'm feeling okay. That's what I was told. I don't need to take the full dosage. Please, enlighten us today, because I got pretty confused.
It depends on the case. So if you get to, it depends on what they're treating it for. So I don't want to say different things and it will not apply to everyone.
Yeah.
So this is where you have to absolutely go to your doctor, because your doctor is giving metronidazole for what? Typically, metronidazole is flagyl. So we already know that, people just take bolus dose, 500 pounds, and that's fine. And that's what typically settles it. But that might not be what you need.
For the condition you have,
just go and take, drink water, calm down, let it ease out, Imodium, other things. It might not be an antibiotic that you need.
Right?
That's it. That's the point. So why are you taking it in the first place, right? Who gave it to you? So
okay,
it shouldn't have been given
if somebody
without a
has an
prescription.
upset stomach,
Yeah.
and, you know, the person is taking water out or maybe something over the counter to, you know, hold the bowels, when should such a person see a doctor? Say, this isn't working, I need to go see a doctor. How long?
I think normally they always say it depends on how severe. So if it's really severe, I mean you're cramping, you're rolling, you cannot even, I'll say immediately. But they always say wait about 24 hours if you're stooling continuously is the typical, recommendation. But I mean, if you're really cramping, you've tried Imodium, you've tried to rest, I'll say your pain and your comfort is very important. You don't want to wait, you know, in case there's something else, there's appendicitis. There's so many things that could be happening.
Okay, that's true.
Right? So you size the pain, size the discomfort, and then that way, but within 24 hours, if you're still back to back, no improvement, my recommendation is to go find someone.
Okay, we said a lot about people using inappropriate self-medication. What is appropriate self-medication? What is a person allowed without seeing a doctor?
There are quite a few prescriptions that can buy over the counter. We call them OTCs. So they're typically things like around pain, headaches, so your paracetamol, your ibuprofen. Around skin conditions, for example, you have a bit of eczema here and there. Like I talked about, you know, you have like a loose bowel or constipation, you have like lactulose, you have like Imodium for, you know, loose bowel to calm that down. Reflux, you know, Pepcid and Co, you have those.
Oh, yes, those tablets we pop, everybody buys them.
You know, strepsils here and there, cough medications here and there, allergies here and there, and they do a good job. But do you know the issue is, I have small cough that I'm meant to just go and use some nice, you know, cough syrup, menthol, a bit of dexamethasone or something like that. I've attributed it to some infection.
And then you go and get antibiotics.
And I go to my pharmacy and give me Augmentin.
That's over-treating, right?
That's over-treating, and it's the wrong indication, because most of these viral infections that we see are not bacterial infections. So they would pass after some days. It's viral. You cannot kill, there's no antiviral that you're going to use for cold. It would replicate by your immunity, by your vitamin C, immunity water, and to treat the symptoms, you know, while you buy over-the-counter cough syrups and stuff, you'll be fine after 5 days, 2 weeks max. But people are impatient. People believe that, you know, and there's a placebo effect as well, I think, that these antibiotics must be given, right? Where people take it and they feel better. Because normally you feel better if you ginger yourself for most of these things, or if you take the right, you know, warmth, care, over-the-counter items, but most will just take antibiotics.
Okay, so what is specialist medication?
So specialist medications are medications that typically going through some form of monitoring, right? That requires consistent checking with the patient in terms of like the drug amounts in the body, right? Whether it's solving for the indication, checking for side effects. So you have like liver function tests, the creatinine levels and things like that. And most of those drugs are typically like oncology drugs, some drugs for TB that are monitored by the government, or like kind of like a protected class, let's put it that way.
So chronic conditions, basically.
They were not necessarily with chronic conditions. It's more, and sometimes, for example, like TB, some even, not necessarily chronic conditions, but it's mostly the actual ingredients, the compound of the drug itself.
Okay, let's go on a short break. We'll come back to all that. Please stay with us. We're going on a short break. We'll be back in a moment. Welcome back. We're talking about rational use of medicines. This is Health Matters on Channels Television. 0808-054-2233 is the number you're to call if you have a question about medicines, medication, dosages. You can tweet at CTV_Mary A and send email moalale@channelstv.com while we continue the conversation. Now, this specialist medication, why would hospitals and institutions have a problem getting these medications? Because I know that some of these conditions are things you have to use these medications over time. If they finish or there's no access, what happens to the patient?
The patient is stuck, right? And the patient is having to ration.
So how do you correct that?
It's really, I mean, leveraging technology helps, right? Leveraging technology helps, supply chain systems. So being able to find ways to communicate throughout the country where the stocks might be.
So you're talking about something like a database?
A database that allows us to say, okay, these are really, really high-risk patients that need these specialist drugs, right? Life or death most of the time. So where can we find them? And a lot
Hold on a second. Let's quickly take this call from Yusuf. Yusuf Adediran. Hello.
Good morning, Mary Alale and the doctor in the house. Yes, I want to commend the pharmacist in there for admitting that we all are guilty, even the pharmacist. But we need to say this, encourage, and they should try the way of fraternizing, making people to know that this thing is very easy. You know, they too, they are profit-oriented these days. You know, seeing a doctor now, apart from the stress of going through them, the amount is much for Nigerian of today. So I think government should also assist. So we all like going to them, but hospitals should make it easy, especially private hospitals, so that we can always accept them for all this. So thank you very much.
Thank you so much, Yusuf. So what I'm going to ask you, taking off from where Yusuf left us, when you leverage technology, is it going to make things worse, harder, more expensive for the patient, or better?
Better.
Okay.
Eventually, because the technology can be cut across different value chain. It can be cut across supply, access. So from the manufacturers, how they leverage technology, how they're creating a database and a platform that allows pharmacists to get their medications easily. Right now, most pharmacies have hundreds of suppliers. I'm not lying. There's no one major supplier that can give them the medication that they order on time.
Okay.
So where manufacturers, how are they leveraging technology to make it easier for them to populate all of these drugs easily for them to order? Who are those guys? Are they working with other smaller suppliers to make this easier? That's technology from the top. Now, from the retail aspect, technology in distribution, people that are sick, that do not want to come out of their house, how can people order online for them to deliver it to them? But not even just that, because we're talking about the end user, the patient, right, being able to manage their condition. So how are they able to now know that they're supposed to take it regularly? How can they report for adverse drug reactions?
Exactly.
Side
He's
effects.
at home.
Right? Because they are home. The pharmacy that they bought it from last month, different from pharmacy on this month sometimes, or they don't even know the doctor that prescribed it to really go back there. So this is where technology can harmonize all of these processes from information awareness of what they're using. So even when you go on Google, right, and you go there, try to find information, technology, information, pharma technology can give you very, very tailored recommendations for you. There's so many algorithms that you can enter your age, your name, your address, whatever it is, your symptoms, and you can give you suggestions for the African. And from there, you can then find out what it is. You can go to a physical pharmacy or even an online pharmacy if you wanted to, and they can prescribe they can dispense what has been prescribed for you, or you can buy over-the-counter items if it is not necessary.
Well, I'm glad you said prescribed, but let's talk about this person who is doing this search on his own in his house. How do you make sure he doesn't abuse it, take the wrong thing, or too much of the right thing? How do you regulate?
So with technology, this can help, because technology really is pretty much just preventing, it's reducing the friction of you having to leave your house. So online, there are still regular physical people that can speak to you, but they're doing that remotely. And when you tell me side effects, I know from my professional practice that, okay, this is the first step, this over-the-counter first. I know you're going to use it for 3 days. If nothing happens, I'll refer you to your doctor.
Okay, so pause. Let's take Joseph, who is on the line from Yaba. Hello, Joseph.
Yes, madam. Good evening.
Good evening, morning, afternoon, wherever you are.
Okay, that's all right. 2 questions now, very quickly. If a patient if they have a tablet for a patient, maybe for a pain relief, and accidentally the pain relief got finished, can he buy a lower one that is used to, that is known. That is one.
Okay. Second question.
Two, I've come across a very terrible situation in this country, especially in the remote area. I don't want to mention names of area. Ajebule and not Balindi and not the rest. You see some group of people. I don't want to even mention.
Are you talking about hawkers?
About selling all these drugs.
Yep.
Hawkers, that's right. Hawkers. Sometimes they have a shop. Sometimes they have a chemist. They call them chemists. You will go to them that you have headache. They will prescribe about 5, 6, 7 types of drugs that are not known in this country. I don't need to be a pharmacist to know they are selling wrong medicines. Because I thank God I'm educated. I should be able to know that this drug is from Saudi Arabia. This drug is not from here. It's through Kano. You see? So they will pack it and give it to people. Unknowingly, they will drink it. And you see them in trouble. There are very many of them in General Hospital today. One of them is my wife's friend. In fact, she's blind now. Cannot see. Thank you very much. Please address
Okay, thank you very much, Joseph.
I want the pharmacists too. What is their community, their society doing to address these issues? Because it concerns them. It will affect them.
Thank you, Joseph. Let's quickly let her answer before we're out of time. What is this? I saw you nodding your head like this is what actually happens.
Yeah, that's what happens. So the first question, so he's been prescribed a pain medication and he wants to buy over the counter. So my question will be, what's that pain treating, right? I mean, if it's paracetamol, ibuprofen, those drugs are over-the-counter items for pain. But obviously, the pain itself, where is it coming from? Is there an underlying condition? And this is where self-prescribing, even though it's over-the-counter, may not be appropriate.
May not be appropriate.
Because what might need
the pain is continuing.
Continuing, and there might be some underlying condition that needs to be treated at root.
Okay, so let's quickly answer the second
question. The second one. The PCN is doing a lot. I think what they're trying to do as well, because we know that, because there's an access issue, so not a lot of people can afford, or there's not a lot of, I guess, resources to have like maybe the typical standard pharmacy. So what they're doing now is the patent medicine sellers, they're trying to have associations and trying to regulate those so that they can actually provide medications for the community, which I commend. But there's another layer lower than that, which he has explained.
The hawkers.
The ones that are not PPMVs, they are not pharmacists, they are hawkers. I mean, where they do outreaches and they do try to get them and with the police force to try to, you know.
And hopefully some people are watching this.
Yeah, they are.
And they will stop.
But sadly, this goes back to education. So educating the end user that is...
And finance, I think.
Yeah.
Finance, I
that,
think.
you know, that is not your pharmacy. So a cocktail drug of, like, there's so many things that, even us, sometimes we do outreaches to try to see what's happening in our community. We have to as pharmacists.
That's good.
And their bottles, they will mix. And then when we now took it out to go and see the compounds in there, and the things that we saw there, things for diabetes, they've said that, oh, this is the fact, this is good, we need to give you erectile function. They combine metformin, they combine so many of these drugs, diabetes, everything together in that conjunction for erectile function. I'm like, no. And we know the side effects.
Okay, we're out of time. Thank you so much for coming. Sure. That was so good. I have to have you back again because we need to cover a lot more. But to the viewer, please, do not take those concoctions. Do not take those things from hawkers. They sell a lot of, you know, things that won't help you. Anyway, thank you so much for being on the show, for watching. Thank you for your calls, Joseph and Yusuf. Thank you. Have a lovely day. I am Mary Alala Yusuf.